East Hartford School-Based Health Center program has been in operation for 20 years. Administered by Integrated Health Services, the School-Based Health Center provides behavioral, medical, and dental health services to children who are uninsured, underinsured, or to those without access to health care. That's a huge population of children in East Hartford.
One of the issues that comes up from time to time is our school-based health centers in conflict with or in competition with private practice. And I think not. I think that really it's two different concepts that support each other.
They are leaders in using the creative approaches to keep children healthy and keep them in a classroom.
We value the school-based health center. We use it all the time. I don't think that our students would be great learners without it. I really don't.
Services provided by Master's Prepared clinicians through the School-Based Health Center include dental screenings and restorative care, individual, family, and group therapy, well child exams including immunizations, acute and chronic care.
The child is being seen by a nurse practitioner. There's a dentist if he's having toothache issues. There's mental health social workers, where it covers a wide array of different resources for the family.
The first day of kindergarten, I couldn't get my pump because it was the first day. A few months after, I knew the school-based health center, and I got the asthma pump from Miss Patty. Now I can breathe.
I like coming here because it's fun, and then me and my friends get to talk about our issues.
When I looked at the asthma numbers that were produced early on and keeping those children in that classroom, returning them instead of taking them to the hospital, having them have to have a visit to their doctor if they even had a doctor. What we discovered is many kids didn't have primary care. So you had to have a vehicle for those families and a place to go, and the school-based health center became that.
When you take a kid out of a school and he has to go to a private practice and he's gone for 2 or 3 hours, that's significant downtime in a kid that's already struggling to get an education. When you have them within the school system, it's like having 430 people in a waiting room. You have these kids back in the classroom learning until you need them.
Well, I started coming to the school-based health center because I've had a lot of issues with absences, but not because of bad behavior. I've had issues with bullying and a divorce with my parents, and I've had a lot of self-esteem issues. And the people at the school-based health center have helped me with that.
It also helps because for referrals, because this place is also a good resource to get you to another place that can get you more help too.
It's just amazing. I don't know any other place that kids can go while they're in school and not interrupt mom's busy schedule to get these services done.
If the school-based health center wasn't here, I probably would have dropped out of high school.
I knew if I didn't feel well, that's where I could go, or if I was having any problems, whether it was in school or outside of school, that's exactly where I would go. It wasn't just to the nurse's office or to SAC. It was just a different kind of comfort zone where you knew you would get the services you needed, but the extra bit of comfort that a child or a teenager needs.
There's certainly a time that comes to my mind of working with a young woman who was in need of some, it hit a point in her life where she had decided that things weren't working out for her and that she was no longer interested in continuing. And if it weren't for the help of the school-based health center and the care of the counselor who worked in the center, the responsiveness, and that immediate feet on the ground, immediate ability to see that student, the story wouldn't have had a good ending, and the story has a great ending.
It would have been different because I would have had to gone somewhere else either during school, so I would have had to missed out of school a lot, and it would have cost a lot.
If the school-based health center wasn't here and I had an attack, I would be in a lot of trouble. It would be very difficult for me to breathe, and I'd possibly have to go to the emergency room, because that's what I did a lot when I was little. I had a lot of difficulty breathing, and I didn't get to go to school yet.
These kids come in and they have, issues, and they go through things at home, and they come to school just for that stability.
I learned how to handle my anger, when you're really angry at somebody. I think back to the future, if I did this, how it would affect my future, and it helps a lot.
I learned to take things kind of like a roller coaster, and that yes, there will be highs and yes, there will be lows, but you know, everything keeps going, and like you won't always be stuck in like a bad spot. That a good spot will be coming, and don't freak out when you know things that were going so well don't go well, because you know things will go well again.
I learned from Miss Harris like not to fight, because like it really doesn't get us anywhere.
If they don't have safety at home, food in their bellies, a level of security here at school, they're not going to learn.
If I wanted a different school and they didn't have a school-based health center, I'd actually feel sad, but it would be okay with me because I'll still remember what I did in Silver Lake.
Honestly, as I say, the wave of the future for all medical care are more community-based and broader-reaching centers, which we're not there yet, but this is certainly a good start, a great start.
We're all trying to make sure that students are safe. We want to make sure that all of our students are safe. Frankly, we want to make sure that they're safe at school, but we also want to make sure that they're safe at home. Aren't we looking at our students more holistically than we ever did before? Aren't we looking at them and wondering what is the environment that they're coming from, what is the baggage that they're bringing to school that really we have to deal with. Having a school-based health center on site gives me an incredible amount of comfort, but there is a very deep comfort in knowing that the behavioral health services are there because we don't have the depth of understanding and the pool of knowledge that comes from a behavioral health professional at a school-based health center.
School-based health centers pay for themselves. In reality, you don't have the expenses you would have if they weren't there.
Without school-based health centers, the students wouldn't be learning to their fullest potential. The kids are able to go down when they have a tummy ache, when they have a toothache, when they have a headache, and there's someone there who's able and willing to help them. We're basically trying to give these kids a chance to learn. I mean, healthy kids make better learners.
I applaud Integrated Health Services, East Hartford Schools, and Goodwin College for being at the forefront of the national movement to create healthier children and healthier communities.
I really like coming here because it's so awesome. Healthy kids make better learners.